60 years since Kenya attained independence, the country has achieved major milestones in the health sector. There has been a significant increase in the number of health facilities, making access to healthcare a lot easier compared to the situation that was there at independence. The number of health workers has also gone up, although there is still a shortage. Now, the advent of technology has also seen several hospitals going paperless, while others are practicing telemedicine.
As the country celebrates 60 years of self-rule, the milestones in the health sector, which is now a devolved function, cannot be overemphasized. Over the years, the number of health facilities has grown, with public hospitals being complemented by private and faith-based institutions. Professor Simon Kang'ethe started practicing medicine in 1973 as a clinical officer, with his first station being Machakos General Hospital.
I was instrumental in the review and the development of nearly all the curricula in medical training college. I helped them to rewrite their curricula in ways that they could help graduates from KMTC be able to go and advance their studies.
He would later work in different hospitals across the country, including Moyale.
And the clinical officers who are graduating were mainly being posted to the rural areas to take care of the rural population. The human resource population was very, very poor. Around 1981-82, the clinical officers in the country who could treat eye diseases were only 40 in the country. When I worked in Moyale, I remember we used to wait for 1 year or even 2 years for the flying doctor service to fly to Moyale to do a cataract surgery. And when they announced that they were coming, there would be 70 or 80 patients waiting.
He notes that back in the day, hospital infrastructure was in a sorry state compared to what Kenya is enjoying now.
You go into some hospitals at that time, you could find that even the toilets that people would use when they come to hospitals were in very, very poor state, very, very poorly maintained. But now you go to our hospitals, they are almost like second homes. They have improved tremendously. Very few hospitals had ambulances. And in those that they had any means of transport, there could be a few Land Rovers here and there.
Kenyan health sector has embraced technology with a vision to have hospitals go paperless.
For instance, if you are in facility A, which could be in Homa Bay or Migori, and you want to consult a specialist here in Nairobi, you are able to do like a scan and share with a specialist who can be able to put meaning into it so that you take intervention wherever you are.
The government has over the years invested in more sophisticated equipment for diagnosis and treatment of diseases. For instance, Kenyans are able to receive cancer treatment locally, as opposed to the past when many had to take trips abroad to countries such as India. The country recently acquired the CyberKnife system for use in cancer treatment. It is a non-surgical and delivers high-dose radiation to cancerous or non-cancerous tumors with extreme accuracy, while not damaging healthy tissue surrounding the tumor. Governments over the years have invested in the workforce with the recruitment of health workers to cater to the growing population. However, health worker unions say that despite these, there is a gap that needs to be filled.
They promised to employ more than 20,000 healthcare professionals. Only 11 counties that are halfway to meet the staffing norm as recommended by the WHO. So that one actually put doubts in terms of the realization of the UHC and the health reform that we are focusing on.
The government is currently focusing on achieving universal health coverage, and part of this entails focusing on primary care. To support these, 100,000 community health promoters were hired to complement health workers at the community level. Nancy Okware, Kenya at 60.